and the suffering that we go through as immigrants, to leave your country, to leave your family, to leave your grandparents, and see your family members die when you want to have a better life. It's the same for every immigrant that comes here to look for the American dream. So the suffering, the need that my family and I went through when we came here, I didn't want anybody else to experience it.
Some of the workers actually gave us a little tour of their cabins there, and we were all just shocked at the way they were living, the conditions they were living, and the lack of resources they had there. And Lily had told me, I want to bring services here. I've been wanting to do this for so long. And I think that's when we kind of put our minds together, and I reached out to Dr. Sam Schneider, who was our program director for primary care at the time, and was like, hey, would you want to start this mobile clinic? Would you be on board to come to these farms and orchards and provide primary care services to these farm workers that are in such rural areas and don't have access to services, or living in these awful conditions? And he was like, yes, let's do it. And that's kind of how it all started.
Raíz does many things. It first started out in Arizona in order to sign up folks for Medicare, Medicaid, and voter registrations. Our affiliate, Greater Washington and North Idaho, we kind of made it our own because we added more services to the program, including all of the above that I mentioned, but adding immigration resources, mobile clinics, food drives, just anything and everything that our community needed. We made it happen through the Raíz program.
Without these workers, our food chain supply would be completely destroyed. We would not eat. The fact that they live and work in such cruel and oppressive conditions is such an issue. And I think we need to realize that these workers are so essential to our livelihood. They have no access to daily basic essentials.
There's a lot of need out there, and Planned Parenthood is giving us the platform to continue that work. We are the only ones literally that are out in rural areas doing these mobile clinics.
We knew there was a big need in this community going into it. However, once we started gaining their trust, they started opening up to us and letting us know more about injustices at their workplace. We knew it was bad, but once we started speaking to them and they started trusting us and opening up to us, we realized that it was much worse than we thought.
People come to us and say, we don't feel, farm workers especially, and they say, we feel like assets. We feel like we are disposable, but you all come here and give us health care, you give us resources, you give us clothes to use. We don't feel that way when you all come. And it's been 3 years that we've been doing this, and they know us, so they feel acknowledged, they feel seen. And they also know what Planned Parenthood is because we educate them on our services.
I just think they deserve so much more because of what they do for us, and it's heartbreaking. And I just want to thank all of them and know that I see you, I respect you, and I'm so grateful for you. And I'm going to work hard so you guys get the treatment you deserve, and you're so important to all of us, and I want people to know that.